Hello, everyone. Thanks for joining us on the news briefing for this Wednesday. Our first topic is COVID-19 information, and I see we have Christy Mishi from Public Health here to share information with us. Good afternoon, Christy.
Good afternoon, May. It's great to be here again. I just wanted to start out with just a little brief overview. Respiratory virus activity remains at elevated levels in Monterey County, as well as across the state and nation. This includes not only influenza, COVID-19, and RSV, but other seasonal respiratory viruses like rhinovirus, parainfluenza, enterovirus, and human metapneumovirus. It's really difficult to distinguish between these viruses based on symptoms alone. Seasonal respiratory virus activity began earlier than usual this season, but it's too early yet to know how severe the COVID-19 and influenza seasonal activity will be this winter. Therefore, it's really important that we continue to take those important measures to help reduce the risk of seasonal respiratory viruses during this holiday season. First and foremost, please make sure that you are up to date on your COVID-19, influenza, and your pneumococcal pneumonia vaccinations if you're eligible. This includes getting the bivalent COVID-19 booster, which can reduce your risk of severe illness and hospitalization by over half. Vaccine locations can be found either on our Monterey County Health Department website. You can go to myturn.ca.gov, or you can go to vaccines.gov. So there's lots of places you can go to find out vaccine locations near you. If you are feeling sick, please stay home. Don't go to work, don't go to gatherings. What may be a mild illness for you could be very serious to others that you potentially expose. Now's the time to consider wearing a face covering in public. Most seasonal respiratory viruses, with them, you're infectious 1 to 2 days prior to showing any symptoms. So wearing a face covering helps prevent you from inadvertently spreading viruses to other people. If you're at high risk for severe disease, now is the time to consider upgrading your mask to either an N95 respirator or a KN95 respirator. These give you greater protection against exposures to respiratory viruses. And if you are considering attending a holiday gathering, please consider testing before and after the event. Home testing kits are really easy to use. If you are insured, most insurances will reimburse you for the cost of the purchase of your kits. In addition, right now, you can request 4 free test kits to be mailed to you by going to covid.gov/tests. This was an opportunity that we had earlier in the season to request through the United States Postal Service. They've opened that up again, and you can get more tests by doing that. Also, free test kits are being distributed by lots of different community organizations, and they're available at some of the county library locations too. Lastly, if you're feeling sick, please make sure you contact your medical provider or visit a testing location. You can go to the state-sponsored LHIcare.com website to find a free testing location near you. And the great thing about these LHI testing locations, there's one in Marina, one in Salinas, and one in Soledad. But the great thing about them is you can also get free treatment there if you test positive and at your high risk of severe disease. So you can get that antiviral treatment that may prevent you from getting really sick and ending up with severe disease. If you don't have insurance and you can't get to one of these sites, there is a sponsored agency that the state health department is supporting called Sesame Care. And you can go to sesamecare.com/COVID. And it's really important to put that /COVID on there because that's what gets you to the free site. And they can set up a free telehealth visit for you and get you linked to COVID antivirals if you qualify. There's also a phone number that's 833-686-5051. And so that's Sesame Care for if you don't have a regular medical provider, you can't make it to one of the LHI's testing sites and you're feeling sick and have a positive test and want to access antiviral treatment. And that's really my update for today, Maya.
Thank you very much, Christy. And I'm wondering, can you give that phone number again for the Sesame Care, just in case people want to double check if they were scribbling?
Sure. Sorry, I probably rattled that off a little fast. That's 833-686-5051.
Thank you. And I do have a couple questions for you. And if there are any additional questions for Christy, go ahead and put them in chat now. First question. According to the county website, COVID-19 numbers decreased this week, and the CDC dropped Monterey County's COVID-19 community level back to low. To what do you attribute the county's decreasing COVID numbers?
Well, I think it's important to look at longer term trends. So we might see numbers go up and down, but overall, since about mid-November, we are seeing an increasing trend. So we may go down a little bit in the short term, but we don't know where that's going to go for right now. There's a lot of things that affect how and why when people test. Some people, may be opting more for home tests, which don't get reported to us. So there's a lot of things that play into how those metrics are assessed. But really, it's important to kind of take a bigger look at things. So we're going to watch the COVID wastewater data. We're going to look at syndromic surveillance information, see what's being reported from our hospitals in terms of ER and admission levels. So I would just caution to, kind of take a broader look at what's happening in the community and pay less attention to changes from a single point in time to the next point in time. We want to look at that overall trend, which right now does indicate that COVID activity is increasing in Monterey County at this time.
Thank you. Next question. What can you tell us about flu and RSV cases and hospitalizations in Monterey County? Are they decreasing, stabilizing, or increasing?
Well, it's important to remember that unlike COVID-19, all cases of influenza and RSV are not reportable in Monterey County. So we have a different kind of a surveillance system for those diseases. What we do know is that the hospitals are reporting that they are seeing, after a small decrease in children presenting with RSV symptoms, they've been seeing an increase in children presenting to the ER for RSV. So we do know that there's an increase in RSV happening locally right now. We also hear that there are people presenting to the emergency rooms, the emergency rooms and hospitals that are testing positive for influenza. So all the indicators we have right now seem to be that these respiratory viruses are at an unseasonably high level here in Monterey County.
Thank you. And a third question, what are the best tips you can provide for people going to large indoor holiday gatherings? I know you touched on this a little bit before, but we're going to narrow down the scope to that gathering.
So first and foremost, don't go to those gatherings if you're not feeling well, or if you've been sick recently. I know it's hard to not be with family and friends on the holidays, but when we gather, we don't want to make other people sick. So stay home if you're not feeling well. Second is, as I mentioned, a test before and after. So if you have a holiday gathering, you have an over-the-counter test, take a test that morning. If you're negative, that's great. If you're positive, stay home. And then what I would do is follow up 2 to 3 days afterwards and test again, just to make sure that you didn't inadvertently pick up something other than a gift from your family at the gathering.
Thank you, Christy. Any other questions for Christy before we let her go for today? Seeing none, thank you very much for dropping in and sharing information with us today, Christy.
Thank you, Maya.
Our next topic is community broadband service. Now, if you have ever wondered if you're getting what you're paying for internet service, a county-wide campaign is underway to help you tell us about that. The county has launched a broadband speed campaign that includes a mapping tool that you can find out where you live, check the speed and the services. And if you aren't getting what you're entitled to or paying for, you can report it. We have people from our information technology department here who are working on this campaign. Sarah House is here. Thanks very much, Sarah, for joining us today to talk about this really interesting campaign.
Thank you, Maya. Good afternoon. So digital equity is achieved through three main approaches: improved broadband affordability, promoting the adoption of the services available to the community through outreach, and lastly, working to improve availability. The latter is a campaign that's being promoted today. So this campaign promotes community feedback that's essential to help challenge the broadband map released by the Federal Communications Commission, the FCC, in November. So this map is provided of service locations and quality reported by the broadband service providers. The term unserved and underserved relative to service areas will no longer be defined only by the service providers, but will include information submitted by our residents. And so improving the accuracy of a broadband map cannot be achieved without the input of our community members. That is essential. And FCC is seeking to get input from the community, our residents, to identify locations that do not have internet service or does not meet the internet speeds as promoted. The County of Monterey is facilitating the collection of the crowdsourced data necessary to submit a bulk challenge to the FCC to improve the FCC map. This is the first time that individual members are asked to provide this information and actually have a feedback opportunity in a portal for feedback. So this information will only be used for the purpose of improving the accuracy of the broadband map through submittal to FCC and to advocate for resources necessary to close the digital divide. This information will not be used for any other purpose and is considered confidential. And January 13 is a date that's a deadline for us to submit a bulk challenge for residents that cannot subscribe to broadband service because service is simply not available. However, the initiative to improve the accuracy of the data for broadband service will continue, and the map will, we will be seeking input from our community members, our residents. To access, to be able to submit this information, any resident can go to www.mcbroadbandforall.org. You can also use the Monterey County app, MCU Connect, which is a mobile app, and you will see that. You can also call the County of Monterey Broadband Challenge line that's been set up because some individuals will not be able to have the opportunity to be able to use internet because they may not have internet access. They can actually call 831-647-7777. And the person on the other line are going to ask you the same questions that you will see on the website. And then our county partner, Monterey County Free Library sites, they also have public accessible computers that our residents can go and access the site and be able to submit information relative to no broadband service.
Thank you very much, Sarah, for running this down for us. I'm wondering, and I showed a little bit of what's on the website for the Broadband for All. Can you tell us a little bit about the experience that people will have when they take the survey? If they go to the Broadband for All, they click to provide information, what will they be seeing?
So what they will see is an explanation. The initial page will be actually just an explanation. We wanted to make sure that our residents will have access to the information in English and in Spanish, and it will explain why and what are we trying to gather, what are we trying to achieve. Then they have the opportunity, should they move forward, is to be able to go to the page that requires, and this is what FCC requires, is the individual name. And be able to take and provide the information as far as the address. If they do not want to provide their actual address number, they can provide a portion of the number, and they can go ahead and submit that information. And what we will do is we will aggregate that information and submit it to the FCC. This site is a lot easier to traverse than just the FCC site, and so it makes it easier, and we can definitely guide our residents should they need support.
And people may have questions about privacy because they are giving some location information as they're doing this, even if they do it at their own home, or if they go to the library. They may have questions about how would my information be used?
So the information will only be used for the purpose of submitting the bulk data to FCC. It will be used also for future planning for initiatives for funding certain areas that are unserved and underserved. Up to this point, we were relying on unserved, underserved information from providers, And now we're going to get down to a lot more detail that allows us to be a lot more accurate in those unserved areas.
One thing that might make people comfortable about giving their personal information is that people may be able to simply give a street or maybe not their specific address. There is some wiggle room in there to encourage people to participate.
Absolutely. Absolutely.
All right, so we have until January 13th. And what happens after that? After
January 13th, the FCC, what they do is they collect the information, and what they will do is they will review the information, and once they review it, the maps will be updated. That does not stop. January 13th is stated is not the deadline for all future information. Our community members will be encouraged to continue, because this map is a living data portal, not static. And from that, we have to make sure that our community members are able to correct the information, and the information that is accessed is going to be a central source, not multiple data sets, as it has in the past. FCC understood that there were challenges to the accuracy. And so this is something that's going to be a process that's dynamic, not static.
And people can really feel like they're contributing to improving connectivity in their community by taking part, because you're getting information in order to do something with it.
Correct. Absolutely. You're absolutely right. In the past, the definition of the unserved and definitions of regions of unserved and underserved was at the census tract level, which you can actually have a household, a couple of households that actually receive service, and households that do not within the same census tract. However, that census tract would be considered served. And that was not the case. That's not the accurate facts. But in order to get the detail, we want residents to provide that direct feedback.
That's fantastic. It's really a great campaign, and we hope and encourage everyone to take part and find out your own internet speed. Did you talk about the speed test also? People
Yes.
can check their speed test.
Yes, what we want to do also is that the speed test is not something you just want to take once. And the reason why is service availability is not just, are you able to subscribe to service? Its availability is, are you getting the consistent speeds that you're actually paying for? So it's okay to test multiple times, and that test is submitted, and that's all that's submitted for, so that shows the availability and consistent availability from the providers.
Thank you so much for walking us through this campaign, and we really encourage everyone to take a minute, find their address, find out, what are they getting what they're entitled to, and are you getting what you're paying for? Thank you all for being with us today, and this is our last briefing for the year. We will see you next year, and we hope you have happy holidays.